Hey guys, welcome back to Contest Prep University. I'm Joe Klemczewski with Adam Atkinson. We're going to go into part 2 of how to manage gastrointestinal issues. So I want to make sure we at least summarize the fact that, as you said, Adam, this is very much a matter of symptom management and trying to link, what symptoms am I feeling to what are the foods I'm consuming? Where are those fiber sources, those supplemental fiber sources, things in these, quote, low-carb foods. But then there are other things that can almost cause a tissue-level disruption. You mentioned supplements, and I've seen even something as benign as specific brands of vitamins. Something in there just causes an inflammatory response. And so you gradually start seeing maybe a little bit of loose stool, and then that turns into some diarrhea, and then that turns into some pain. And then pretty soon you can have full-blown, life-altering, chronic ulcerative colitis if you're not careful. So all kinds of horrible situations you could get yourself into if you're not catching and managing and assessing symptoms early. So I think we all know people who have gone that far, Adam, but you mentioned things like supplements. Have there ever been other things you have caught that have caused severe GI issues?
People definitely doing too much fiber. I had a few clients who thought it was free because they were working with other coaches and their calories were so low. By the time they came to me, they were consuming so much salad and so much vegetable, which is the least healthy thing you could do, and probably one of the worst things you can do for hunger management. It's still going to pass through the hepatic portal, and that's still going to be caloric too. So a lot of people don't realize that that undigested fiber does get used as calories down the road.
Yeah, it actually is converted to fat, like you said, taken up through the hepatic portal system. But also, to your point, that's just roughage. That's harsh debridement of the tissue. I mean, think of your large intestine. You've got this mucosal lining, and then a submucosal lining, and then a dermal lining, and then you're into muscle tissue. So that's why it's not that difficult to have ulcerations. And even before you get to that level, you can have subsensory levels of inflammation that are just starting you down that road. So you could even take out an inciting stimulus, a supplement, or we mentioned branched chain aminos. Sometimes somebody can just take one serving a day, and all of a sudden they start having diarrhea, and they think, well, that's okay. That's just that's normal now for me, I guess. And they don't realize that that is slowly eroding and inflaming the different linings of their large intestine. So something to really pay attention to. Don't think that this is a normal part of dieting or eating healthy. I've seen people who start having GI issues, and they think, oh, that means I should eat healthier. So then they'll start eating more raw kale and broccoli and these things that just destroy them. So sometimes to reduce inflammation, you have to actually induce a level of what you would think is constipation. So you have to eat more rice, more, less fiber, and let your GI system calm down a bit. So do you have any recommendations for that, Adam?
Yeah, I actually had a client doing nationals that their bowels just became a lot more loose. And I said, let's pull out, let's look at all of your fiber sources. We actually got rid of all of them to try to form some binding agents for stool formation. So we went with like rice cakes and brown rice and got rid of all of their fiber sources, almost trying to cause a backup, so to speak. And by the time they hit the stage, they had much better control over their digestion, because it was pretty traumatic. Their plane, they said they had to get up 3 times during the flight, and I was like, this might be something we can't control on stage. So when they got off the plane, we definitely changed up their food sources, and they were fine by show day. So
yeah, and when you have fecal urgency like that is a telltale sign that your large intestine is so inflamed that anytime stool matter is reaching those distal parts, that your body just wants to get rid of it. And so you did the exact right thing, which is to get rid of fiber, try and induce a much more solid stool. then you can gradually reintroduce softer, more benign, more soluble forms of fiber. So again, guys, big topic. You know, we can't cover every nuance here, but the main thing is if you're starting to have any GI issues, even something as subtle as just always feeling bloated, there's a reason, there's a cause, and it's in your best interest to make sure you figure that out and eliminate those food sources. So we can talk about that with some Q&A in the comment sections, but hope that helps this, guys, and we're going to move on to some more topics in our how-to series. Thanks for watching.